Hey everyone, Eugene here with American Insurance Benefits. I wanted to do a quick tutorial on how to sign up for a Medicare Part D drug plan. Now they've changed a few things on this website when you go to medicare.gov that I want to bring to your attention, and I want you to know why these changes make it a little bit harder for you to find the right Medicare drug plan for your specific situation. You can find a plan one of two ways. The easiest way is to call 1-800-633-4227, which is 1-800-Medicare. And by doing so, you'll speak to a representative, and they will ask you for some personal information, your Medicare card number. They also want to know what your drugs are that you use, and then they're going to give you a list of plans that you get to choose from. Now, when you pick a plan, you want to make sure that you pick a plan with the lowest out-of-pocket cost to you, and that's important because that takes into consideration the medications that you told them that you're taking, as well as the price of the plan. So don't look at deductibles, don't look at the monthly premium. What you want to do is the lowest out-of-pocket cost to you. Again, by calling 1-800-Medicare, that's the easiest way to do it. Now, if you're a person that wants to do this to themselves and you don't want to call Medicare, then you can go to medicare.gov, which is going to bring you to this website here. And in the middle, you'll notice it says Part D, drug coverage Part D, and on the bottom it says here, find health and drug plans. Now, when you type in your zip code and you go to find plans, this is the change that they made here. It automatically pulls up all the plans in your area, but the problem with doing it this way is you haven't yet put in your medications yet. So the plan that it's recommending is not related to any of the medications that you have, which means that the plan that it's showing might not be the best option for you. And as you notice here, that they're not really organized in any specific way except the estimated annual drug costs, but they don't know what medications you're taking. So this is the change that they made. This is not how I recommend you do it. Back up at the very top, it says type search term here, and just type in enter drugs. And then it says here, Medicare Plan Finder for Health, Prescription Drug, and Medicare Plans. I would encourage you to speak to a representative that deals with Medicare supplements to find the best plan for a Medicare supplement. But I recommend you go to Medicare directly to find your drug plan, because with so many different counties in the country, so many different drug plans available, it's very hard for us as agents to keep up with all of them. And we don't want to get licensed with one or two and then tell you, hey, this is the one that you have to get. This is the best one that's best for you, when it might not be the case, because your medications that you're taking might be that you would have to go into a different drug plan. So by going up here and you typing in the search field, enter drugs, it's going to bring you to this page here. You type in your zip code, hit enter, find plans, and then you're going to tell them you have original Medicare and that you don't get any extra help. If you get extra help, then you would find what's relevant to you. But if you don't get any extra help and you have original Medicare, not Advantage, because Advantage, your drug plan is already tied into your plan. But if you have original Medicare and a supplemental plan, just put down here that you don't get any extra help and you continue to plan results. Now, this is what I was talking about here. It's wanting you to enter your drugs. This is why I wanted you to go to the search field and type in enter drugs, because it's going to bring you to this page here, and it's going to tell you to enter your drugs. So let's type in our first one. Let's type in lisinopril, for example. And let's say I take a 5 milligram pill. I get 90 pills every 3 months. I get a 3-month supply. You get this from a retail pharmacy, so I put in the dosage, I put in how many I get when I get them refilled, and how often I get it refilled. So then I hit add drugs and dosage, and it's going to put it to a list. And you want to do this for every medication that you take. So let's do another one. Let's say I'm taking metformin. Let's say I take 500 milligrams, 60, let's do 180 every 3 months. Add the medications. And let's say this is the only medications that I take. My drug list is complete. I pick a pharmacy that I might be using, and it just organizes based on the radius from the zip code that you put in. And you always want to put in your zip code because you want to pull up the pharmacy that you're using. So let's say I use CVS, I add the pharmacy, and then I continue to plan results. So far what I did is I put in my medications, I selected my pharmacy, and now it's going to take me to a page where I get to select the different prescription drug plans, Medicare health plans with drug coverage, and Medicare health plans without drug coverage. Here's what you don't want to do. You don't want to click on health plans with drug coverage because this is not Medicare. It's talking about Advantage here, as well as anytime you see Medicare health plans, they're talking about Advantage. They're not talking about supplemental and original Medicare. See, and you can see the distinction here. They put with original Medicare here, and then they put the alternative to Medicare, which is Medicare Advantage, which is not original Medicare. Keep that in mind. What I want you to go to is click on prescription drug plans with original Medicare, and you continue to plan results. And then it's going to pull up all the medications. Now, this is what the page is going to look like. Here's what I want you to do. First, I want you to look at the top here where it says current profile, drug list ID. Write that down somewhere, as well as the date that you searched for. This is the 15th. We only have a couple of weeks left to select a drug plan for this annual election period. You want to do this for one of two reasons. The first reason is if, let's say, you decided that, I looked at all these plans, but I want to think it over before I make my selection, and I want to come back to this at a later date. This is the information that they're going to need from you, and your list of medications, whether it was 2, 10, 15, 20 medications that you took that time to put in, you don't have to do that anymore because it's going to pull it up with your drug list ID. It's saved in the system for you. And then the other reason is if, let's say, you wanted to, add more medications later. You made a mistake and you forgot about one, etc. And you want to go back in and you will put another medication into the list to see if it changes the plan that it recommends. So the first thing that it talks about is your original Medicare. This is what you have. This is your Part B, and your premium is $104.90. You have your $147 deductible. So it just talks about what your current plan looks like. Then if you scroll over to the second section, it talks about the prescription drug plans. Now, here is a few things that you want to pay attention to. You can pay attention to how you can sort the results. You don't want to do it by star rating, obviously not by the lowest monthly premium or the plan name or the drug deductible. What you want to focus on is you want to focus on the lowest estimated annual retail drug cost. And what that does, if you click on this question mark here, it's going to say that this is an estimate of the average amount you might expect to pay for each year of your prescription drug coverage. This estimate includes the following costs as applicable: monthly premiums, annual deductible, co-payments, co-insurance, and costs that might not be covered by the plan. So if you notice, we'll look at Envision as one, for example, that it recommends. It talks about the annual drug costs. This is what it's being sorted by. So as you continue down the list of plans, the out-of-pocket is going to grow. So in this situation, this specific plan works best based on the medications that I put into the system. And the annual cost is going to be right around $1,300, which includes this monthly premium, which includes all the co-pays, which includes anything that might not be covered under the plan, and then it talks about the overall star rating. But what you want to purchase your plan by is by the estimated annual drug costs. When you speak to a representative, if you decide that you want to talk to somebody over the phone to do this for you, which they're perfectly capable of doing all this, just like what I did in the system here, just tell them that you want the plan with the lowest estimated annual drug cost. That's very, very important. Then you notice here the monthly premium, it can be deducted one of two ways. It could be deducted out of your Social Security check every month, or it could be drafted from your checking account. The deductible, this one that specifically does not have a deductible. Some have a $200 deductible, some have a $360 deductible. But again, it doesn't matter what the deductible is, because even if the deductible said $360, but the lowest estimated annual drug cost was still the lowest on the list, you still want to go with that one. That's very, very important. So again, there's a few things that you have to do to maneuver to get to this page, because this page is specific to the medications that I put into the system that I might be taking. So if you have a list of 20 different medications, you want the plan that's being recommended to fit your needs specifically. And that's very, very important, because when we do it originally, if we go to Medicare.gov and you type in that you want to get a Part D drug plan, find health and drug plans, it takes you to a different page. So I'm going to put in my zip code. It takes you directly to the plans, and it might not necessarily be the best option for me. Even though in this case the list is the same, it doesn't know the medications that I take, so it might be that Express Scripts comes up as number one, or Humana comes up as number one, or AARP comes up as number one. You won't know that unless you put the drugs into the system, and the way you do that is by typing in enter drugs, and then clicking on Medicare Plan Finder for health, prescription drug, and Medigap plans. This will then maneuver you to the spot where it actually tells you to put in the medications. If you have any questions on how to navigate this, feel free to rewatch this video. You can always subscribe. There's going to be tips and tricks on how to maneuver and play with Medicare, whether it be the website, how to sign up for your Part B through Social Security. We're going to have that coming up here in just a little bit. So anything that you need information on, whether you need help with your Medicare drug plan, how to enroll to a Part B, which direction to take on your drug coverage, call us. We're more than happy to help you through this process. My name is Eugene. We have a team of very talented individuals who can help you through this process. Our phone number is 803-542-5068. Again, my name is Eugene. Thanks for watching. Remember to subscribe, like this video, share it. Let folks that you know learn how to do this, because this is something you need to be doing every single year.